Hello guys, I'm Dr. Karasu. I welcome you all back to this new session on headaches. In this video, you're going to be learning a few things about headaches. What's the definition of headache and what are the different types of headaches, and when do you really have to pay attention to your headache, and when you have to go see a doctor for this headache, and when do you really need to get a CT of the brain or MRI of the brain, and the different modalities of treatment for headaches. This is what you're going to learn in this video. So please make sure you watch this video without skipping. And I also request you to subscribe to my channel if you have not yet, and please do like it or leave a comment down below this video. Okay? So let's get in there, guys. Headaches. What's the definition of headache? It's just a pain arising from the head or from the upper part of the neck. That's headache, right? And there are so many different causes of headaches. When any patient comes into my clinic, a patient A would say, "Doc, I have been having this mild headache for the last 1 week or so, but I've never had this headache a week ago. It's just since this so much of stress on the job, I think it could be because of that." And the patient A would say that, and patient B would say maybe like 40 years of age, and he would be complaining of, "Doc, I have this headache for last 1 month. Sometimes it really works. Sometimes I can manage it with medications from the pharmacy, but really it worries me and it really troubles me a lot when this headache gets worse, or when I do any activities, or when I lift any weights, or when I bend over, things like that." And patient C would say, "Doc, for the last 4 or 5 months, I had this pain, which was okay, that I was able to manage that headache. But since last 1 month, the headache intensity gotten worse, and it's even more worse now. I'm not able to focus on my daily activities." So different patients will complain of different things about their headaches. What causes this headache? What are the types of headaches we have? When a patient tells me like this, I will have some questions on my mind to ask my patients. First of all, I would always ask site of the headache. Where do you have this headache? Whether it is in the frontal area, or on the temporal area on the sides, or over here on the parietal area, or exactly right in the back, which is occipital area. So frontal area, temporal area, and this parietal area are exactly in the back, which is occipital area. So based on the sites, diagnosis can also change. It gives a clue to the doctor what he has to order, what kind of test he has to order next. And intensity of headache. I always ask my patients, on a scale of 1 to 10, how bad this pain is. 1 is the least pain, 10 is the worst pain you have ever had in your life. So a patient would say, "Doc, it's just 2 to 3 by 5, but then when it gets worse, it goes up to like 5, I would say." That's what their pain scale they would give me. And the next thing I would ask for quality of pain, whether this is like a throbbing pain, or a squeezing type of pain, or a pricking pain, or pulsatile pain. They have this pulsar, boom, boom, boom. That is pulsatile pain. And another characteristic about the pain, whether it is a continuous pain or intermittent pain, like this. It stays there for an hour, and then no headache for like 4 hours or 5 hours, and then again headache for another 1 hour. This is like continuous and intermittent. And the mild headache, or severe, moderate headache, and severe headache. So on this one, onset. When do you get this headache? You get this headache right in the morning, or day, or somewhere in the afternoon, or in the evening, or at night. What causes this headache? Onset. Some people wake up with headache, okay? And then I always ask about the radiation of headache, whether this headache radiates elsewhere, into the neck, or into the shoulder, or into the arms. All right. And then associated factors, whether you also have nausea or vomiting, or any other symptoms associated with headache, like blurred vision, or maybe like a toothache, or maybe like a bad sensation, bad smelling sensation, or maybe other associated symptoms. And aggravating factors. What causes your headache worse? Like bending down or any activities. Some people would have this excess headache while engaged in sexual activities, and some activities would make the pain better or go away. So the alleviating factors. What makes your headache go away? So when I ask all these questions to my patients, they would give me a set of answers. So with these answers, I would just think, okay, what is exactly going on in this patient? So when I classify these headaches, it's a primary headache and secondary headache. Okay, primary headache and secondary headache. Under primary headache, we got a few diagnoses like tension headache, migraine headache, and cluster headache. And in secondary headache, the definition of secondary headache is because of something we have headache. But in primary headache, there is no something, there is no cause. Headache happens for some reasons, but in secondary headaches, maybe different conditions like maybe head trauma or infection or inflammation or any like psychiatric illnesses or any other causes. But in a primary, there is no real underlying causes for this primary headache. So tension headache is more common in women. They always complain of neck spasm in the back of the neck, nape of the neck. The neck is very spasmodic. When they get this headache, during the afternoon time, because as the day progresses, their activities also progresses, and then the tension builds up and they get this headache. That is tension headache. Migraine headache is also different. Migraine headache has got so many subtypes that they always have a unilateral headache. Sometimes even also has bilateral headaches, a pulsatile sensation, and many migraine headaches will be associated with nausea and vomiting. And lastly, we have is a cluster headache. Cluster headache mostly occurs in men in their late 20s. They have a typical symptom suggestive of a cluster headache. They come in with pain around the eyes, and then they always complain of watering of eyes in this cluster headache. So this primary headache is over now. Let's deal with the secondary headaches. The secondary headache, it could be because of anything like any simple anemia can cause headache, vitamin deficiency can cause headache, or inflammation of the brain or brain layer cause headaches, or any tumor can cause, a brain tumor can cause headache, or any trauma can cause. For example, if someone has received a blow to the head, a simple concussion or contusion, or even if it leads to bleeding in the brain or hemorrhage can cause headache. So this all comes under secondary headaches. Or in some autoimmune conditions like temporal arteritis, any things can cause, and then any metabolic disorders can cause, even a simple, like hypertensive emergency, they also come in with a very bad headache. And then neoplastic conditions, and even in psychiatric conditions, they also complain of headaches. We have to pay more attention to this headache. When do you really have to go see a doctor? If you notice any changes in your vision, or if you notice any altered sensation on your face or in your arms or your legs, or any weakness in your arms or legs, you will have to go see your doctor. And then if there is any ongoing process like any fever or weight loss or excess weight gain, you will have to go see your doctor immediately. Okay. And then how do you can manage your headache at home with using home remedies? If you think that your stress is causing headache, then you will have to recognize what are the stress creating activities, and you will have to minimize those. So recognize and minimize your stress related activities. And what you have to do next is keep yourself very much hydrated, because simple dehydration can cause headache. Okay. And exertional activities can cause headaches, like when you go to gym or when you lift any heavy objects. Those things can cause headache. Some infections like meningitis, encephalitis, or any other inflammation can also cause headaches. So we have to find some home remedies, go for relaxing activities, keep yourself hydrated, and so keep all these things in your mind. As I told you before, you have to go see a doctor when these alarm signs are noted. If there is any unusual change in the intensity of headache, you have to go see your doctor. Or if there is any associated activities like seizure, something like that, you will have to make sure you have to go see your doctor. Else, if the intensity of the headache is very static, 1 or 2 on a scale of 1 to 10, or if it is a mild headache, you can just take simple analgesia, paracetamol, even with this paracetamol, some headache will not go away. So in that case, if it's a persistent headache despite taking paracetamol, you will have to go see a doctor and get an MRI of the brain or a CT scan of the head to make sure everything is okay in the brain. Okay guys, I hope I have given you enough information on this video. Okay, I'll see you all back in our next session with more information on a different topic. Until then, it's Dr. Mahesh that's signing off. Bye bye guys.